Hey, welcome to the Relentless Positivity Podcast. I'm your host, Joe Martin, and we got a returning guest today. We have Karen Peterson back from Wellstone, and she was on the show. Listen to this episode 119 back in October of 2022, which has almost been 2 years. It's so crazy, but we talked about something in that episode we're going to revisit today that we're both very excited about. It's going to impact a lot of people, and she's back to share this is a project that's going to have a huge impact on our community, and it's going to affect what the Surgeon General has called the defining public health issue of our time. So, Karen Peterson, thanks for coming back on the show.
Well, thanks for having me. I can't believe it's been almost 2 years. Let's make this an annual thing if we can.
We should, yeah, because you had a very impactful episode. If you haven't listened, I'm going to link it in the show notes. Go back and listen. We got a ton of great feedback about that, and you helped a lot of people with your story. So, thank you for that. So, for people that don't know what Wellstone is, please tell us what Wellstone is.
So Wellstone is really North Alabama's mental health leader. We have been around for more than 50 years, providing mental health care and services, substance abuse recovery treatment plans for individuals, for children, for adults, for adolescents for more than 50 years. However, there are a lot of people who still don't know who we are. We started trying to rebrand a little bit in 2017 when we fully changed our name to Wellstone. And that was an effort to eliminate stigma. Instead of saying, hey, I'm going to the mental health center, be back in an hour. It's, hey, I'm going to Wellstone. It sounds more positive. It sounds more health focused. It sounds less frightening or intimidating. So, I started, it'll be 3 years in the next day or so. And it's gotten a lot better. More and more people are learning about what we do. We are a 501c3 nonprofit mental health center. No one is turned away due to an inability to pay a fee. In fiscal year 23, we served 12,000 children, teens, adults, and we provided more than $4.5 million in uncompensated care. That is care that, in essence, isn't paid for by the client or the patient, whatever the case may be. And you think of someplace like Huntsville Hospital, we are similar to them, where we aren't going to turn some away because they don't have the resources. We are a public nonprofit. That is our status and our identification, basically.
Very cool. So I kind of teased it in the intro, but I didn't tell her what it was. So tell us what's going on with this new project, which is almost finished. It's coming out soon. Tell us about this.
Well, I will. And just one more little bit of background. We have this big program that's coming is one of more than 80 programs Wellstone offers to the North Alabama community. We are primarily in Madison County and Cullman County, but we also provide emergency services to individuals in mental health and substance use crises. So we were one of the 3 original in the state to open a 24/7 standalone mental health emergency care center, and that is known as WES, or Wellstone Emergency Services. We got to do the acronym because Huntsville. Gotcha. So WES is basically a standalone ER for mental health. Previously, we had individuals who might have been in a mental health crisis. They may have been suicidal. They may have been in self-harm mode. They may have been experiencing a psychotic episode. Maybe the first one, it's terrifying. You don't know what it is. Or they may be behaving in an extremely peculiar way that the police are called. And these individuals would end up in jail or the emergency room. Now they can come to us because we are experts in mental health. So, they're kind of, in jail, who knows how long they'll stay. They certainly aren't going to get better in jail. The emergency department, they do amazing work, but psychiatry is not their specialty. And so they'll stabilize them and typically tell them, here's your next step once you're out. But it's been a long time revolving door. So we have really made a difference in individuals, in adults, men and women with mental health and substance use crises. So we serve about 150 men and women every month. And the beauty is they come in there and they are welcomed in with love and compassion. It is not like any stereotypical psychiatric unit you may have envisioned or experienced personally, someone out there. It is wide open spaces, big rooms, big windows, just a lovely, lovely, warm, open, healing facility. And so that's been going great. It'll be 2 years in October that we've been operating that. And here's the clincher, and this is what you've been talking about. We in Madison County have no inpatient psychiatric care facility. So that's unacceptable, obviously. Everyone who recognizes this enormous gap in our continuum of care for mental health recognizes that this is unacceptable, especially for a community of our size and our passion and our generosity. So after we had already been thinking, what can we do to provide care for these children who are hurting and who are being transported to the tune of 800 children per month being transported by HEMSI, the local ambulance service, out of county to Decatur if they're lucky. About 400 get transported to Decatur, which is the closest for us. Others are transported wherever they can find the bed. This would be Birmingham, Chattanooga, Franklin, Tennessee, or as far away as Luverne, Dothan, or Mobile. That 800 doesn't take into account the children who are taken privately by their families. Maybe they're cleared to be taken privately by their mom or dad, or maybe the parents know where to go and just go ahead and bypass the ER altogether.
Goodness. That's such a need that people don't even think about. I mean, if you haven't been involved in this, then you don't know what's going on. It's just a serious problem. It's going to just keep getting worse. So you guys are stepping up and stepping up to the plate. Do you have any stories along those lines or stats to kind of go along with this need? You mentioned some of the stats on there.
I do. And I think we had talked about the leading that suicide. Well, first of all, for adults, 2022 had been the worst year for adult suicides in the US since they started recording data. And from 10 to maybe 24, it had long been, suicide had long been the second leading cause of death for that age group. Well, also in 2022, the CDC reported that suicide had become the leading cause of death for 13 and 14-year-olds. So it is devastating. It's a tragedy all over the country, and we've experienced suicides within those age groups here in North Alabama. And so we are really excited to get this up and running. We are having a ribbon cutting in September. The Alabama Department of Mental Health is coordinating this effort. It's going to be a big day, a big, bright, sunny day for mental health in Alabama. This will be the first of its kind in the state. And we will have 24 beds available. It's 12,000 square feet. There's an awesome courtyard with basketball courts and there will be games and a celebration room. So even the discharge process will be different. Instead of just your traditional discharge, they'll go and celebrate the next leg of their recovery, because you don't have a mental health crisis or a substance use crisis and just get fixed in one visit. Typically, it's going to be in many cases it's a lifelong journey. Sometimes, especially when you're thinking of youth, it can be something, let's address this, and maybe it is something temporary, but they are going to make sure that child is taken care of, and that there is follow-on care, and that there is a case manager assigned to that child to make sure that he or she is doing what they're supposed to do to maintain that level of recovery.
Wow, that's amazing. I can't wait to see it. It's going to be so cool. So
Yeah,
what kind of mental health issues will they be addressing at the center?
So, right now we're looking at a lot of depression and anxiety with our children. We are looking at, there is a broad range of what constitutes a crisis, but it can be, somebody having their first psychotic episode. Maybe there has not been a diagnosis, and somebody is is experiencing paranoia or delusions, so they may think somebody or something is after them. So it may be something like that. There is likely to be suicidal ideations, self-harm with those age groups. And we are starting with the 12 to 18 age range and to start. But it can really be somebody who can't calm down, somebody who is just having, what a parent might describe as a complete meltdown, and they can't bring that child back.
Yeah. Wow. If you, I've been witness to something like that before, and there's just you panic. I mean, there's
Yeah.
people don't know who to call, what to do. So now we have a place to go and to get those kids some help. So can you walk me through kind of when they show up, kind of the admission process to discharge and everything in between? I'm curious how it all works.
Yeah. So, and I'll kind of to give you an idea too, just to raise awareness since it's been a while. So, same thing for the adult side. So, for the adult side, they can be brought in by HEMSI. They can be brought in from any of our neighboring community law enforcement officers. We work with them a great deal, or they can be private drop off. Now, they will see a triage nurse before they do anything else, because the nurse has to make sure they're medically cleared. We are not considered a true hospital, whereas, if somebody's having a stroke or some levels of something are dangerously high, they need to get to the emergency room and have that taken care of first, and then they can be transferred back, and we can take care of them there. But otherwise, they will, if they're medically cleared and they are determined to be an appropriate case. The Alabama Department of Mental Health has very clear policies and procedures that we follow as to what constitutes a mental health crisis. And so if it is considered a mental health crisis, then they are admitted. Just like in our adult, they will see a psychiatrist. If a psychiatrist is not on hand, there will be a nurse practitioner. They will see a therapist. We'll have peer support specialists, which are people with lived experiences. It could be someone who had a mental illness, growing up, but is now in recovery and can say, look, I went through this and I'm okay. Those are the folks who are really the demonstrators of this is going to be okay. You are going to get over this. There are so many kids who are suffering now, and we want everyone to know, and we want families to know that they are not alone. There is hope available. There is healing available. And, we're ready to welcome them in with open arms.
Wow. Yeah, that's it. So you mentioned before about how, you're not going to be fixed in one visit. How does the follow-up program work?
So if they have another provider that they have been, seeing, we can coordinate with that person. Otherwise, we will coordinate. Part of the beauty of Wellstone is we have so many programs. We have outpatient psychiatric services. We have outpatient therapy services. We have outpatient substance abuse recovery programs for adolescents and adults. We do have an inpatient alcohol and drug addiction treatment center, but that is for adults. And so we are able to plug them in. If they need help from another agency, we can do what we call a warm handoff with that other nonprofit. This is a collaborative project. Wellstone can't do this alone. This is a true community effort.
Yeah, I like the warm handoff. That's good.
I know, I like that.
You're not just
But I did want to read something that a physician had shared with me. He is a Huntsville father, but he's also a physician in an emergency department. And for him, he was talking to me about both the adult and the children's crisis center. And he said, I'd like to say that I can just shut off the emotional response to these situations. There have been days and times when this was easier than other times. Sleep deprivation and consecutive shifts can take a toll on the emotional protection we must provide ourselves when trudging into everyone else's problems and dealing with empathic response gone awry. Overloaded by the sheer firehouse of negative emotions we must engage during a normal day. There have been times I was in tears at the thought of a man shooting himself simply because I knew he was going to do it if I couldn't convince him to stay and seek the help he needed. But what's heartbreaking is seeing so many youth of various ages check in with concerns for self-harm, wondering why they can't see how much time there is left to make positive changes. For many of these patients, the door revolves, and it's hard to know I can't do much to help them besides order the labs and request the screening. There's a lot of patient abandonment by parents also. There are a lot of children who just needed two parents growing up. Could have done with one, but what they got was less than that somehow. As a father, that aspect is heartbreaking.
Wow. Yeah, I'd like to think that's why it's so important. You have people that have gotten through this and they say, hey, I did it and you can do it too. I think that matters more than anything else.
Oh, it does. And whether it's in substance abuse recovery, mental illness, or, and I think we see that in cancer patients as well. Often there's somebody that grabs them by the hand and said, I made it through this. You can too.
Yeah, that's it. I was talking to someone in recovery this morning that talked about, hey, I saw this person. I said, if she can do it, I can do it. And man, it goes so far with people. So
It's very, very powerful. One other thing I wanted to share was, and this is a nice pat on the back for Wellstone that I'd like to share. West Pediatric serves a great need in our community and hopefully will continue to grow its foundations in the region. There are so many who can't find an accepting facility in the entire state closer than Dothan. We desperately need more pediatric psychiatric inpatient care for stabilization of a very serious epidemic of pediatric mental illness.
wow. And now we got it. Now we got it. It's coming.
Almost. It's coming. It's coming. Yeah. Yeah. So, and when it comes, we will be screaming from the rooftops. We are, for those who aren't familiar with our main location, we are at our main building is at 4040 Memorial Parkway, kind of sandwiched between Rosie's and Edgar's. But, and the pediatric unit is an addition to that new construction for Wellstone Emergency Services that you see just north of our main building.
So if there's someone listening right now, maybe their children need some help. What's their next step for getting in touch with Wellstone?
Well, if they are, if it's after our Wellstone Emergency Services, they can call 705-6444. Area code 256 and get connected to Wellstone Emergency Services. If it is before then, they can do a couple of things. They can call 988, which is, it used to be the National Lifeline Suicide Prevention Hotline. And it is now a 988 three-digit number, basically the 911 for mental health. They can call that number. Those calls are fielded locally by Wellstone crisis-trained therapists. We have mobile crisis units. So there are phone numbers for that I can share with you too if you want to post them. I don't have them off the top of my head, but 988 can get them in touch with you as well. Mobile crisis units for adults and pediatrics. They can be called out. Sometimes a crisis can be de-escalated before it becomes a full-blown crisis. Maybe there's somebody causing a scene, hollering at somebody that they, whether it's an estranged family member or someone they think is coming after them and really disturbing the peace, so to speak. This mobile crisis team can come, or if it is a big blowout with a family, when it's a child and a parent, the mobile crisis pediatric team can come out for that as well.
That's great. Yeah, if you could share those, I'll put those in the show notes so we don't have to memorize. Yeah. That'd be good. So there's probably people listening right now that you mentioned earlier. You're a nonprofit. You don't have all the money in the world. How can the community come beside you and help with this project?
Oh gosh. So we have something called the Be the Rock Capital Campaign. We will be wrapping it up at the end of this year. We have been trying to raise, we revised our goal, $2.5 million. When I started here, I really wanted to raise the entire gap for the project, which was pretty significant. And I thought, we'll raise all the millions, so many millions of dollars. And the community has been incredible, but I was a little unrealistic given the time we're in, the and some other factors involved, but and the connections we had to some extent. But we have had people connect with us, and we have grown our relationships tremendously, and we have raised now over $1.5 million
Awesome.
and had just incredible support. Probably our biggest ones, the Alpha Foundation. We have also had Hank Eisenberg and Iron Mountain Solutions and the Probst Family Foundation. Those three have been the largest supporters. But I mean it when I say every gift matters, because there are gifts of $50 and $100 that pooled together helped us reach that tally of 1.5 million plus. But we are still accepting donations. And if you look for the Be the Rock capital campaign for Wellstone in Huntsville, it'll pull up, and I will share the link with you as well. And there are some great naming opportunities. Sometimes people want, whether it's in honor or in memory or bearing their own name, to recognize and be associated with a project that is so transformative, so desperately needed. This will save lives. We've seen it over and over again in the adult facility, and we have no doubt that Wes and the pediatric unit will save our younger lives as well, and at the very least change them and put them on a different track.
That's it. It's a huge problem, and y'all are doing something about it. I'm so excited to see people stepping up and seeing this problem and say, we're going to do something about it. So I'm very excited about that. So do you have any kind of parting words before we turn over to the next one?
The city has also been generous. The county has been generous. Madison, Huntsville, the state of Alabama has been incredible. Our local Madison County delegation, the community has really embraced us. And that tells me pretty much what I've known all along, that this community cares, that this community is not afraid to talk about or support rough subjects and rough topics. So, we just want to shine the light. For so long, the whole realm of mental health and addiction has been just kind of, let's just stick it over here in the corner. And what happened? It just was silent, and then it exploded. So it's always been bad. But I heard once, mental illness and addiction cannot live in secrecy and silence. That is why I often share my story, as I did with you 2 years ago. That is why I encourage, if it feels right for others, to share their stories, because someone is going to hear your story, and they're going to know that they're not alone, and that there is help available, and that there is hope.
Man, that's all you need, is just a little bit of hope. And if you're listening right now, you want to donate and help them, because this facility, here's looking up some 12-year-old little girl who's thinking about ending it all. It's going to have her life saved by this facility. It's going to happen. And you could be a part of that. That's so amazing. I love what you guys are doing. Like I said, I'm trying to do my part as well. So thank you for what you guys are doing. You're going to change this whole community. So keep it up.
I will. And I will get you that website so people can look for it. It's easy. They can do a recurring gift monthly. We'd love to see our monthly donor base grow, because that is a true, that's something that you are doing monthly and regularly. And that says, oh my gosh, I see what you're doing. I see what Wellstone is doing. I believe in what Wellstone is doing, and I'm going to invest and become part of that project.
Awesome. That's it. And they're listening right now. If you're listening, also, please share this episode. Maybe someone else needs to hear this. They need to hear about this facility. Maybe they could use it, or maybe they want to support it, but they need to hear about it. So please share this episode. Karen and Wellstone, keep up the great work. I love that y'all are part of this community. It's so exciting. So keep it up. You're listening right now. Please turn in next week for the Relentless Positive podcast. We'll see you then.
Thank you.